Go.
Alex, what's
What's
wrong?
wrong,
What's
Alex?
wrong, Alex?
Oh no, I saw this is a prescription. Like my kitchen this morning. My mom, she's on prednisone and dexamethasone. I think she gonna die. She gonna die.
Wait. We studied those last week in Farm. Didn't you pay attention?
No, I don't pay attention to Dr. Cormier's class. We just use this time we have. This study for next week. What are they for?
Glucocorticosteroids, they suppress the immune system. They are used as an anti-inflammatory or immunosuppressant medication. A lot of different conditions such as allergic disorders, skin conditions, ulcerative colitis, arthritis, lupus, psoriasis, or breathing disorders. They stimulate an increase in glucose levels of energy, and they form and store fat for the body.
Okay. Well, how does it work though?
Oh, well, that's easy. They enter target cells and binds to cytoplasmic receptors, initiate anti-inflammatory reactions. They give the body a chance to heal from the effects of inflammations by blocking arachidonic acids, which causes the decrease of prostaglandins and leukotrienes, and impairs the ability of phagocytes and lymphocytes and block the production of antibodies.
Oh, okay, yeah. I think I'm starting to remember. Prednisone, that's oral, right? By mouth, and dexamethasone. Man, it says like so many routes. Like, what are they again?
They're given orally, IV, IM, inhaled, intranasal, ophthalmically, and also topically. It peaks quickly, but it does last up to 3 days. And prednisone, although it is a drug of choice, it does last, like its effects last 1 day. Also, please talk to your mom and make sure that she's not pregnant or anything, because it does cross.
My mom ain't pregnant. What are you talking about?
It crosses the placenta, and it does enter the breast milk. So just for future purposes, make sure that she isn't allergic and that she doesn't have an acute infection or anything, because it can worsen the infection. Diabetes can disrupt the drug. Peptic ulcers and any endocrine disorders are contraindicating the use of that. So watch out for that. Make sure she knows what's up with it.
Perfect. Is that it?
There's more. Warn your mom about the adverse effects. There's a lot, so I'm just going to read them to you. Vertigo, headache, paresthesia, hypotension, shock, thromboembolism, hypokalemia, sodium water retention, muscle weakness, osteoporosis, cataracts, glaucoma, petechiae, purpura, ecchymosis, amenorrhea, irregular menses, diabetes, impaired wound healing, and immunosuppression.
And immunosuppression?
Yeah, immunosuppression.
Wow, I forgot about all of those. I don't know how I'm supposed to remember that.
Yeah, it's a lot, but you have to be aware of them. Also check to see if she's taking salicylates, barbiturates, phenytoin, and rifampin, because they can decrease the therapeutic effect. If she's using erythromycin or ketoconazole, your mom will see increased effects.
Okay, wow. I appreciate all the love. Thanks for all the information. I'll be sure I tell my mom, let her know.
We're glad to
Glad
help.
Glad to help.
Anything else?
Yeah, make sure your mom takes them between 8 and 9 a.m. and that she uses minimal dose.
All right.
Make sure she knows how to take. She tapers the drug after long therapy. She shouldn't stop it abruptly, and not to take them with live virus vaccines, because there's a risk of an infection.
Okay.
Make sure she is protected from infections.
And remind her to get blood tests.
That's it.
That's it.
All right. Thanks.
Well,
appreciate
besides
it.
that, if they are used the right way, prednisone and dexamethasone can really help your mom with whatever she's struggling with. So I'm sure she'll be fine. Just make sure she remembers all this stuff, and it'll probably help her with whatever she's having a problem with.
Thank you.
You're good to go.
Appreciate it.
Yeah.
Thank you.
Yeah.